Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Good evening. Thank you for joining us. It's Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. They're offering free screenings for the next couple of weeks. We'll give you numbers to take advantage of that offer because all you need to do is call them and schedule an appointment. Also want to give you this number because this is the number you can call us live with your questions. It's 1-888-634-7488. Tonight we're going to be exploring women and sports injuries. Women and sports injuries, our topic tonight, our toll-free number, 1-888-634-7488. Answering your calls tonight, we have Dr. Rosemarie Boehm. She's with the Rothman Institute. She is a orthopedic specialist.
Primary care sports medicine.
Primary care sports medicine. Next to her is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Again, the number 1-888-634-7488. And since we're talking about women and injuries, why is it so important, Dave, for women to exercise?
Well, we want everybody to be able to exercise, but tonight we're talking a little bit more about women, so we'll talk try to get into a little more understanding of why women, there's some specialties actually. You want to increase their flexibility, increase their muscle tone, increases their muscle strength, okay, increases endurance, cardiovascular system, increases the athletic performance for an athlete. It decreases the low back pain, decreases osteoporosis, arthritis, breast cancer, decreases osteoporosis, but also diabetes. That's a very important one. But more importantly, obviously, another one for women, it also helps their menstrual cycle. It helps them regulate their menstrual cycle better if they exercise on a regular basis. So there's some general. I just touched a few, but there's a lot more we could talk all night about the benefits of it, because there's many more. I'm sure some I missed, but I think I hit the major ones. So it's real important that women do exercise.
And you hit on one of them that's very important this month, breast cancer. This is Breast Cancer Awareness Month, which is why the ribbon is, can you see that? Pink ribbon there.
Yeah.
Reminding all women everywhere, make sure you keep up with those mammograms. Now talk about osteoporosis, Dr. Boehm. What is that?
Well, osteoporosis is actually thinning bones. It can be in males or females. It's much more common in women, but it's actually the bone structure is thinner, so they don't have the same amount of bone density.
So what happens to the bones? They get brittle, or?
Yeah, they can become brittle. They actually can fracture easier because there's not as much calcium deposition. The bones are not as strong, so they're more likely to fracture their bones if you have osteoporosis.
Now, what about exercise and weight training? Does that help decrease the risk of this?
Certainly does help. For women, weight-bearing exercises are the best for women if they can weight bear and walk. That's why women have a hard time going into space, because lack of gravity, they're not getting a lot of the benefits of bearing weight on their joints, and that will increase bone. As we weight bear on our joints, we increase bone density. Also, weight training has been sort of shown to increase your bone density also by if you do some even low weights, high resistance, low weights, more repetitions, you're pulling on your muscles, the muscles are pulling on the bones, and theory would be that you would increase your bone density from being stronger.
All right, Dave. Now, how do you treat people with osteoporosis?
Well, it's like the doctor said, weight-bearing activities are real important. I mean, you really want that stimulates the bone strength. But a lot of times when we see, as a physical therapist, we see a lot of people that come in with osteoporosis because they usually have fallen and fractured their bone, something like that. So what we do a lot of times with our patients, we put them in the pool early, even though it's not a weight-bearing activity, but that's because we're working on their balance. A lot of times they have poor balance, they have poor proprioception, and we need to work on some strengthening exercises before we feel they're comfortable and safe enough to do some of these bone weight-bearing activities on land. So we started them out in the pool for like 3 to 4 weeks, make sure they're secure with that, build up a little bit of muscle tone so they feel secure and they feel confident. A lot of times they come in, their balance is lost too. They don't walk properly. They lost their gait because they're so afraid of walking. They're afraid of falling. They're real short steps. So we're going to work on proper gait balance. And we do all that, and then we bring them on land and start to work on the weight-bearing activities to stimulate the bone.
All right, we're talking about women and sports injuries. You're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. If you have a question, our toll-free number is 1-888-634-7488. Dr. Boehm, do you look at women athletes differently than male athletes, and if so, why?
Well, as we talked about earlier, that's a very loaded question. As a doctor and as a athlete, I have to say yes and no. As an athlete, we don't want to see women and men different. That's the whole premise behind Title IX. College athletes being treated for federal funding. College athletes being treated the same amount of teams for men and women, same opportunities. So in that sense, we don't want to treat them. We don't want to look at them differently. But as far as injuries go, and as far as the sports medicine part of it, we do have to look differently because there are differences, musculoskeletal differences. There are structural differences. So we really need to look at those. And then there's different injuries and different reasons why they're getting injuries. So we have to sort of look at that whole package and see what we can change.
All right, our toll-free number is 1-888-634-7488. I understand we have a question about a knee injury, and the caller is Tim from Bluebell. Tim, go right ahead with your question on Sports Doctor. Did we lose Tim? We might have lost Tim, unfortunately. Probably realized it was a woman's show today. But what are about the muscular skeletal differences between males and females, Dr. Boehm?
Well, you know, when children are very small, boys and girls, there is no difference. And then when children hit puberty, we start to see a lot of differences in men versus women. Women have a wider pelvis, the pear-shaped. We talked about the pear-shaped with the wider pelvis for childbearing. We have what's called knee valgus, where our legs go out more a lot of times. Women often have flat feet. They have a lot of ligamentous laxity, so their ligaments they're the double jointed that people talk about, where they have a lot of laxity in their joints, so they have a lot more motion than normal people. Women have shorter, smaller bones. Also, they have smaller articulating surfaces. The surface between the two bones is often smaller. And we also have a lower center of gravity. So all this makes it different in the amount of weight training, not the amount of training we can do, but what we can achieve and what injuries happen and how the body responds to the training and to the injuries.
All right, back to the phone lines. Our toll-free number, 1-888-634-7488. We have Joyce on the line from Pleasantville. Joyce, go right ahead with your question on Sports Doctor.
Yes, I'd like to know what type of weight-bearing exercises are good for the prevention of osteoporosis.
All right, very good. What type of weight-bearing exercises? We mentioned lifting weights as a preventing osteoporosis. What type of weightlifting exercises would you say would be the best for someone trying to avoid that condition?
Well, I would say for weight-bearing, you were asking for weight-bearing, I think. That's a little bit different age-wise. If you're a younger woman, then you can do weight-bearing as you can do running, jumping, plyometrics. As we get older and we're trying to preserve our joints a little bit more, then you want to do walking. Walking on a soft ground, soft treadmill. That's the best weight-bearing. You're not damaging your joints, but you're also getting the effects of the weight-bearing on the bones.
How about lifting weights? Is that ever something that women should do?
Yeah, anything you're doing to forces, there's a force on the bone. So the muscle tendon junction attaches onto the bone. So anything that's creates a force to that bone actually is shown to stimulate bone growth. So weightlifting is very good for people to have bone density problems.
All right, I think we have Tim back on the line. That's what they're telling me from Bluebell. Tim, go right ahead with your question on Sports Doctor.
Hey, good evening, guys. How are you?
Good.
Good.
I have a question about the knee and I guess muscles in general. I was wondering, do Schwoogies run faster?
Do what?
I don't know, I think we lost him again. But you know what, since he's talking about the knee, why don't we see the knee anatomy there, Dave?
Sure. All right, let's talk about the knee here. This is a right knee. This is the femur. This is the bones first. This is the tibia. This is the fibula. This is the patella. The superior patella tendon, inferior patella tendon. This is the lateral collateral ligament. This is the medial collateral ligament. Now let's go inside the knee, where I wouldn't say everything happens here. This is the lateral meniscus. This is the medial meniscus. This is the anterior cruciate ligament, or ACL. I'm going to turn it around. It's the PCL, posterior cruciate ligament. And that's a basic anatomy of the knee.
Now, you mentioned the ACL, and I understand female athletes are particularly vulnerable to ACL injuries. First of all, is that true, and if so, why, Dr. Boehm?
Well, it's definitely true. We have found a larger percentage of women athletes that tear their ACL than men. It's somewhat sport dependent, so men playing soccer, some different sports, but we find the majority of them are in women. We don't know exactly why yet. There's a lot of research being done. They've come up with a lot of theories as far as it being hormonal. Women have a lot more hormonal changes. They've looked at whether the muscle strength is different. They've looked at whether the notch, which is in here, is larger in women and or smaller in women and may pinch. So they're looking at a lot of those. But really, basically, what I think it comes down to is that we're looking not only what causes it, but how to prevent it. And I think when we're looking at the things to prevent, and Dave can probably talk about those, then that will allow us to see what's causing it, because we're making changes in these women, how they're doing things, and I think that's helping to prevent them. So I think that may be some of the causes.
All right, let's get into prevention then,
Sure.
Dave.
Obviously, you want to increase your flexibility, avoid positions that can create the injury, increase the muscle tone, joint stability, work on proprioception, and most importantly, work on plyometric exercises. We're finding a lot of the women that have a lot of problems with their ACL are not landing properly when they're jumping, like in basketball and soccer and stuff like that. They need to come down and land in a squatted type position. They're landing with their knees straight, and that creates too much stress at the ACL. And that's how a lot of times they tear it. So we need to teach them the proper ways how to jump, how to explode properly, how to come down on 2 feet and come down on feet, not flat feet. Not on their heels. So those are things that we're working on, and we're finding really good results when we're teaching them the proper way of how to land and teach them proprioception, where their foot is in space. And when they come down like that and they learn it, and they got to practice this. This doesn't come naturally. When you train these things, we're finding we're having less injuries when we do that.
What are plyometric exercises?
Plyometric exercises, you do that with boxes. When you're coming up in different levels, you're jumping, coming up on them and coming down, jumping down and landing properly. And you're learning how to explode off them and how to come down and land properly. And there's different levels. As you get better, you go higher and you train off those.
Okay, they're telling me we need to take a break. I want to remind you, you're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro. There are the numbers. If you'd like to call and make an appointment, take advantage of that free screening offer. Call the office nearest you. Also, we are talking women and sports injuries tonight on Sports Doctor. We'll take your calls next. Our toll-free number, 1-888-634-7488. Stay with us. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Welcome back. This is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. We're joined tonight by Dr. Rosemarie Boehm. She is a sports medicine physician with the Rothman Institute. Next to her, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Tonight we're talking women and sports injuries. If you have questions, our toll-free line, 1-888-634-7488. Be happy to talk to you. And before we take some calls, tell us about some common injuries that happen to women in sports, Dr. Boehm.
Well, as we already talked about, ACL injuries are a big one. We see that quite frequently, and we see that in all different age groups of women. We also see a lot of overuse injuries. Women have a tendency, because of their laxity we talked about, their joints are being lax. They tend to have a tendency to overtrain, or they have a lot of overuse syndromes, knees, tendinitis, things like that. They get a lot of instability because of the laxity. Laxity in joints is good in sometimes. In order to be a baseball player or a softball thrower, you have to have a certain amount of laxity in your joint to be able to get the motion to be able to throw. And there's a very fine line between laxity and then instability. And a lot of women cross that line and become unstable, and they can't control their joints, so that causes a lot of problems. It also can cause impingement because they don't have that ability to control their joints. Everything gets kind of pinched in there, so they get some impingement. Women have a lot of foot problems. Invariably, we have bunions and flat feet.
Does that have something to do with their shoes that they wear?
Certainly does. Part of the issue is in women's shoes, we try to get into these very small shoes with big heels, puts us in a bad position, and trying to get the toes all crushed into a very small front. We really need a wide toe box and a smaller heel. But they don't look as nice, so we don't like to do that.
Got to stay up the softball field in high heels.
So we get heel pain, we get some bunions. The flat foot part is more hereditary. That's
Sure.
We can't, that doesn't come from wearing the shoes, but the shoes don't help that situation.
Remember those great Easy Spirit commercials where the women were playing basketball?
Playing basketball in
Yes.
their high tops, right? Which then we'd have a lot more ACL injuries.
That's it.
So there's also SI joint, which is the sacroiliac joint, and another big one in women is stress fractures. Women, they want to do their pounding exercises. We want to get out there and run. Sometimes they overtrain. They run too much. They don't wear the right sneakers, and they get a lot of stress fractures. And stress fractures are where they put a lot of stress on a bone, and it doesn't fracture through. It's an overuse, and it's sort of like a fracture inside the bone.
A lot of times these are hard to diagnose, are they not?
Stress fractures are very hard to diagnose. But they do have a common pattern. They'll start, basically, the women will come in and they'll say, it started with my activity. I was, running. Then I noticed it when I got done running. I would start to have the pain afterwards. Now I have pain all the time, and it's in my lower leg. I'm a runner, and they're very tender over that spot, and they can't jump up and down. There are certain things that we can look at. If you take a tuning fork and you stick it on there vibrating, they don't like that because it's vibrating the fracture. So we're finding, and there are tests that we're looking for them more. So we're finding them more and we're treating them more.
All right, let's go to the phone lines. Our toll-free number, 1-888-634-7488. Debbie is our next caller from Williamstown. Debbie, go right ahead with your question on Sports Doctor.
Hi, yes. I work out every day, and I'm having a little bit of a problem. I have a pain that kind of comes out from my backside, and it wraps around to the front of my hips. Can you tell me what that would be?
Okay. Difficult to make that diagnosis without actually seeing, but people with symptoms such as that, what are some possible conditions?
Some of the possible first thoughts would be that it's coming from the back and it's your sciatic nerve, which is, people get sciatic pain down their legs. Sometimes that can be the start of it. It comes out of the buttocks and comes around. As we started to talk about, is the sacroiliac joint, and that's the joint that connects the spine to the pelvis. And that also you can have problems with motion there. Not enough motion, too much motion, that can cause some pain around. Piriformis syndrome, which are tight muscles in the buttocks, once again pinching the nerve and causing some pain around.
Make sure, like you said, it sounds like she said she's exercising every day. Sometimes it's a good time, and a lot of times it's not. If you're exercising every day, you need the downtime. And also you need to make sure you're stretching before and after you exercise. As a female, I think it's very good possibility. A lot of times they just tend not to do that. They really need to stretch, and they need to stretch before you're exercising and after. And if you're exercising every day, you have more of a tendency to get tighter and have a little more stiffness. So you really need to make sure you stay on top of your stretching program, and you need to stretch everything. I mean, if you're just doing upper extremities, you need to stretch the whole body. Start from the head, you go all the way down to your feet. I think that's very important, and that might be something that you're missing. Make sure you stretch your pelvis as well. I mean, there's your hip flexors, you got to stretch your hip extensors. So if you're not sure what you're doing or you have some questions about that, please take advantage of our free screening that we offer. You live right there in Williamstown. We have an office right there in Sicklerville. We have an office right there in Washington Township. We'd be glad to take a look at you and maybe give you some ideas of what you should be doing.
Yeah, and look for those numbers. We'll have them for you at the end of the program to schedule an appointment for that free screening offer. Our toll-free number, 1-888-634-7488. All right, we've got Kathy on the line from Cherry Hill. Kathy, go right ahead with your question on Sports Doctor.
Hi, this is a question for Dr. Boehm. I wanted to ask her if she recommends a particular brand of athletic shoe for aerobics, and also how often do you recommend buying new shoes or changing shoes?
All right, a shoe question for you, Dr. Boehm.
Great questions, Kathy. Well, first of all, there are, years ago, women's shoes. We didn't have women's sneakers, so we just bought men's sneakers. Now there are certain brands where they're actually looking at the woman's foot. And probably the best brand, not that I want to sell any particular brand, but Asics is a very good brand for women. New Balance is probably the best. Asics is also a very good shoe. They're made with the women's foot in mind, meaning we want a wide toe box, we want a tight heel, and we want to get the foot into a better position. And then for aerobics, you want to make sure you're getting an aerobic shoe. So you want to get a shoe that's good for that. And as far as when you change your shoes, if you're a runner, you have to change them more frequently. It's every few months and a certain amount of miles. If you're doing aerobics, you can get a little bit more wear out of them. One of the best ways is to look at the bottom of your shoe. See if it's wearing away, if the treads are wearing, especially if they're wearing unevenly. Then you definitely need to get new shoes. Or if you are going over in your shoe and the sides are pulled out, then it's time to get new shoes.
All right, thank you for that phone call, 1-888-634-7488, Neshaminy, Pennsylvania. The caller's name is Dee Dee? Dee Dee, go right ahead with your question, Dee Dee, if you're there.
Yes, I'm right here. Can you hear me?
Yes, I can.
Okay, I just had a question. I wanted to know if women are more prone to injury after they have babies. Because I recently hurt my bodacious jawbones trying to catch Bob Levy's kids.
We didn't even mention childbirth. What effect does that have on a woman, and are they more likely to have injuries after that?
Well, it depends on how far out they are from childbirth. There are certain guidelines for actually when you're pregnant. There's actually guidelines for who should exercise when they're pregnant. But once you've delivered your baby, around the time of delivering your baby, obviously your ligaments have to become more lax in order to be able to deliver. Your pelvis has to open up. Your ligaments have to become very lax. Your body starts making hormones, relaxin, which allows everything to open up. So you are more likely to have some injuries as far as that with stretching and with more of the laxity. As you get away from childbirth, that's farther out, your ligaments will be, you won't have as many of the hormones around, and you will be tighter again. But yes, initially on, you have to be very careful, and you have to really stretch and be concerned about what your joints look like.
All right, we're talking about women and sports injuries. Our toll-free number is 1-888-634-7488. Sports Doctor brought to you by Cross Keys Physical Therapy Sports Medicine Center, located in Sicklerville, Woodbury, Washington Township, Vineland, Swedesboro, Pennsville. There are the numbers on the screen. If you'd like to take advantage of that free screening offer for the next 2 weeks, call the center nearest you, schedule an appointment. It's as easy as that. We're coming right back with more of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rothman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
Welcome back to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. If you have questions for us tonight, women and sports injuries, you can reach us at 856-767-8884. Our guest this evening, we have Dr. Rosemarie Boehm. She is a sports medicine physician. She is with the Rothman Institute. We also have Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Again, 856-767-8884 to reach us tonight on Sports Doctor. We talked a little bit earlier about how women are vulnerable to ACL injuries. What options are available for patients that have torn their ACLs?
Well, it depends once again on the age, their level